Good evening. This is project which is basically term test based on the data analysis on the COVID-19 situation. And my name is Sanjit Kamath, and I'm going to present this slide of my term test to you. First, as we start off with the introduction, COVID, which stands for coronavirus disease, and 19 is mentioned because it was discovered in the year 2019. This is because like the virus was first originated in the Wuhan city, which is located in central China's province of Hubei. This disease is particularly found in bats and later was transmitted to humans due to the consumption of bat meat by people, and also the unsanitary ways to sell the bat meat from the markets in Wuhan. And though the disease was initially started around the month of December, that which is of the Christmas month, and then after slowly and slowly it started to spread across the globe. Though it started off as an epidemic, not even as an epidemic, but as a local flu. But then it was the status was evaluated to epidemic as it spread across China, and then when people started visiting China and Wuhan especially, and when they were moving from one place to another, basically traveling, as Wuhan is one of the industrial cities in China, the people acted as a carrier for the disease, which led to the transmission across the globe, and it was turned into a pandemic. And World Health Organization, which is known as WHO, finally declared it as a pandemic. The data set we which are selected from was from the module which was being provided by the professor, and the name of the data set is lineless data. The data set dealt with the cases in the country, reporting date with which the countries have first recorded, and also noting the age of the people, and who are being affected, and the gender of the people, followed by their trips to Wuhan, and from Wuhan to the other places, the locations which have been recorded in the dataset, and also the symptoms. The basic objective was to find the age group of the people which is largely affected by the virus. Now, once the dataset was downloaded, it contained a total 1086 values, but also contained a lot of missing NA values. So, since the NA values don't contain any information and are of no use when executing the program or the analyzing the data set to be precise, so this need to be cleaned up, and I just cleaned up using in Excel itself using find and replace, and then it was later it was reduced to a limited 134 values, though it's pretty less, but enough to analyze the data, as because this disease, this pandemic is like currently very much new to us, and not much data is available. Even though I tried searching it online, but I couldn't find a satisfactory data as compared to this. Then these are the descriptions of the variables used. So the first variable being the case in country, which states that the number of cases in the country where the virus was detected. So for country, it can be country or any places. For example, like there is one location of Seoul, which is located in South Korea, and there is a certain specific number of cases which is being defined over there. So around that, in that, by the time the data was collected from that area, they have shown that so many so many people have been affected. As a result, so many cases have been registered in this place. So for some places like Singapore, which is already a city plus a country, because like it's not that big in size. So as a result, it is classified as a country first of all. So, and there are a lot of there's a lot of data about Singapore, so which classified it as a highest in everyone among all the places. Reporting date. The first known reporting date is like the first date where the recording date of the virus, which is being done by the officials in their official log, so that they can keep a track of the disease when it started. And location, as I said previously, that which cities was the virus was being detected. Then gender is like out of how many males and how many females have been affected by the virus. Age is particularly important it is as it ensures the people, not only the health professionals but also the normal people, to understand who's being affected by the virus most. Visiting Wuhan and from Wuhan is like keeping the record of people who visited Wuhan at a certain time from a certain location with like which is being mentioned in the data set, and from Wuhan. So like it keeps a record of person who has visited the other place from Wuhan. So as I said before, that Wuhan is one of the most industrial cities, like industrial oriented cities in China. So there is a lot of movement of people for industrial purpose, be it workers or like be it any people from abroad going and visiting the places to keep track of the manufacturing and so on. So this is an important aspect. So why this should be kept a tab on. Then then death is like if a person, if he's dead, then the record has to be kept and recovered. If a person is when makes a successful recovery, then it also should be kept. So like we do realize that so many people have recovered once the pandemic is over, or like this person has made a successful recovery. Whereas the zero value just keeps or tells us that that person is neither recovered, he's not dead, compared to the one which is mentioned over there. Then symptom, this section is basically as recorded the symptoms faced by the people. And this is like important when for the future purpose, especially for development of medicines. So when the medicines are being developed, the medical team has to pharmaceutical people have to, the healthcare I mean the healthcare professionals have to keep track of which all symptoms have been occurred, and accordingly they have to make their medicines. Then approach, then while analyzing this data set, it is that I've considered three important things, which is first being the location, as it is very much important to consider this aspect, as it helps us to detect where the virus is highly concentrated or highly present, so that this can be for this location can be further sealed off, or like certain measures can be taken against the people from visiting it. And the age group is also important because of the medicines which need to be manufactured or like could be prepared by the pharmaceutical companies. They need to know like which people is like highly affected. And the symptoms, and as I said, these are like the common symptoms faced by the people suffering. So like this can be anything based on the virus. And this is the first visualized graph. And as you see, Singapore is highly affected. And this is one reason of Singapore being highly affected is it is a country and as well as a city, which is a small city located on an island, as everyone is aware of. But the thing is, like, it contains a large migrant population. Like for example, Dubai, like they don't have their people of their own origin, but they are more. Singapore is a multicultural place, and people from all over the world come in, and it's a business capital, one of the most important financial cities. So as a result, like a lot of people from the world to come in to work, to stay, to reside, obviously, compared to the other cities, like other global cities, which I would consider as Hong Kong, then Seoul, probably, but not as compared to Singapore. So these are the places which are like others though are affected, but not as Singapore, because like because of many people living there and working there, and then the inflow of people from all over the world, and which causes the virus to especially the Chinese people where the virus originated. They are highly concentrated in Singapore because there are lots of Chinese people who have small time businesses, not necessarily at the higher level but also at the lower level, where these people come in as a migrants, and then they like they earn some money, and then they go back to their own place, own country, and start up their own business in local their own cities. So if a person has come certainly from China, and then he has come in contact with 10 others, so like this disease being a respiratory, so he will be affecting other 10 people, and as a result of which these people coming in contact with other 10, or be 20, so like these will be affected. So like as a result, Singapore did the virus did spread quickly as compared to the others. Though even though the other kind of cities like Hong Kong is like, even though it's a small and considered a separate territory, separate country, but it's a part of Chinese territory. But Hong Kong is certainly more advanced, and I'm pretty sure like they took quick measures as soon as the virus broke out. So as a result, I think that's my assumption that Hong Kong doesn't have much damage compared to Singapore. So as I said, that's it. And the graph of the age groups. This is the bar graph depicting which age group has been affected the most. As you see, there are like it's divided into three categories: the child, the youth, and the old age people. With the highest casualties being in the old age people, with the least casualties being in the child. So first, I think I would talk about the child because it's less casualty, so but positive to talk about. And as we know, like children are like being taken care of the parents, which prevents them from getting coming in contact with the different strangers and all, which prevents the transmission of the disease. And then also like children's immunity power is like on a growth, and every parent ensures that his child is healthy enough, so as a result he or they ensure that their child is like immune to all this diseases or viruses which are like constantly coming. Whereas if you ask a child, the death rate is comparatively higher in the newborn kids, as they are like just born and they don't have much immunity power, or like as obviously as they are newborn. So there's a bigger fatality rate among those. Whereas the old age group, the death rate is high because like after a certain age, people who don't take care of themselves, especially they have a lot of issues like diabetes, or blood pressure, or asthma, or anything. So like these are the causes, these things are caused by like people smoking, or not eating, not having a proper diet, so which the body needs, and not exercising regularly, not taking care of themselves, as a result of which. So these are the problems which cause, which like taking though we are taking medicines, but the thing is like the body's immunity power becomes less and less, and when such a powerful virus like COVID or corona strikes, so the body is unable to respond to it. So as a result, the old age people are hospitalized, and they don't have that immune strength to fight off the virus. Whereas the youth are in the mid range. So I think that is because like most of them are the working class, and like though they have developed good immunity power, but the thing is like they do have to take care of themselves, like everyone should. So if they don't, then they are also again into coming into the same category as the old people. Like they will face the symptoms, and they are in danger. And secondly, that these people also have to ensure like the steps need to be taken, like washing the hands frequently, and later on wearing the mask, and proper mask should be worn to in order to provide protection to yourself. And also ensure that you maintain a certain hygiene, as a result of which people don't around you people don't get affected. So, and this is the third graph which observes the symptoms. So if a person who is contracted the virus, so has as we see, like majority of them have fever, followed by fever and cough, and sore throat, which is like third, and fourth comes as fever and malaise. So though this symptoms do differ from person to person, I think fever is the most common thing among all. So if a person feels that he is having a high fever, then he should definitely go to a nearest doctor and check himself for whether he's positive for corona or not. I better hope he's negative, because we don't want any more fatalities. And the other symptoms being diarrhea, cough, tiredness, fatigue, and but I think so that would be more towards the old age group than compared to the youngsters, because tiredness is something the youth may not feel that much compared to the elders. Whereas yeah, fever is like as I said, it's common to all. So anything can happen. And as I was searching did my research a bit, and it's like the people have high fever for a time, and then the fever just goes away. Then later on the other symptoms do start popping up, so as a result of which they need to be go to the doctor or need to be hospitalized if needed. And then these people need to be put in the ventilators on the ventilators. And like, though that's more of a case with the older people, I haven't heard much from about the youth category, from the youth, or from others. So it is, so one needs to take care of it. The further actions which need to be taken is so like in order to this further actions need to be taken in order to prevent the spread of the disease. So as currently the things stand, the medical kits are like pretty much no, in shortage. So the companies must ensure like the masks and the safety equipments are manufactured at the earliest. And many cities in the world have currently went into complete lockdown, with Singapore, as I just said, as I analyzed that it is highly affected by this, has recently announced the lockdown for a month, so in order to contain the virus. So like these things are essential. And also like one needs to frequently wash their hands, then one shouldn't touch their eyes, nose, or mouth by hand. So like this is directed by the World Health Organization, so one of the important things. And as being not only respiratory, but like if for example if you have you're coughing, and the cough, like the water droplets which are like released by the cough are on your hand. So and if a person is a corona positive and he touches a door knob or a handle or anywhere else, or door basically, so there's a good chance that the virus will survive for hours on it. And and the other person who's touching it will be infected as a result. So by being unknown, that person who is coughing is spreading that virus and causing more issues. And as a result, though he himself is affected, but he's also making others infect, and as a result, like causing more danger to the people. And one also doesn't know if the other person is immune, like has a good immune power or not. And if the person do not abide by the law, then strict measures need to be taken. Like for example, in India, the government had imposed the curfew, and the ones who are breaking that curfew, the police are taking strict actions. Depending on the person, if he's willing to listen, then he has been given a light punishment. So, like for example, just kneeling down, or like a duck walk or something like that. And else, if a person is not abiding by that thing, by the warnings or anything like that, so he'll be like given a proper beating. So though it is on the harsh side, but the uh, the officials are doing everything to contain this. And it is also necessary to seal off highly contaminated regions to prevent the spread of virus. So sealing off basically means that you are cordoning off the area, and people over there should be put in complete lockdowns. And though they shouldn't be allowed to go outside, but they should, instead of allowing them to go outside, they should be provided with the essential goods like groceries and all for their needs. By So that this should be done by the people from the government officials, who should be doing this task with complete protection from head to toe. So like you can also say that wear something that resembles the suit from which the people used to protect themselves from the nuclear radiations. So it's better as much possible as you can. Whereas the analysis which I conducted found that the majority of the people are from the older age groups, as I said, that they don't have much immune power, and due to the health problems and all, so the recovery rate is also low. So, and from the symptoms, as I found that the cough and fever are most common, and as a result of which it is advisable for people to keep their mouth and nose covered, and ensure maintain a 6 feet gap among two people when walking, so which currently is known as social distancing. And most importantly, it is to prevent the spread of the virus, it is necessary that people cooperate with each other, and ensure less casualties are caused. And this will not only ensure quick recovery for us, quick recovery for us in the sense of like getting the country back on track, and also doing our daily tasks from our respective location, instead of sitting home and working it out. So these things do do play an important part. And as a result, it is necessary to this analysis was like important to ensure that though it is like where it's currently being spread and all, and the steps currently which the and also like to decide on the further actions which can be taken. Thank you.